When we reach the age of 60 and beyond, the human body begins to whisper certain messages to us, signals that reflect decades of work, family, and the silent wear and tear of life itself. As a surgeon who has observed thousands of aging bodies on the operating table and in rehabilitation wards, I can tell you that mobility and balance are not just physical abilities, they are markers of overall vitality and independence. And in Japan, where people commonly live well into their 90s with remarkable agility and mental clarity, there is a daily ritual practiced by many elders that deserves our attention. 5 gentle morning movements that require no gym, no equipment, and no trainer, just commitment, awareness, and consistency. These exercises are deceptively simple but biologically powerful. They work not only on muscles and joints, but also on circulation, hormone balance, and cellular health. In Japan, elders view the morning as sacred. Before breakfast or even coffee, they perform a series of fluid movements designed to awaken the body's internal systems, what we in medicine call neuromuscular activation and circulatory priming. The first movement is what I would describe as the joint awakening stretch. It begins with gentle rotations of the wrists, elbows, shoulders, and ankles. You can imagine it as a way of greeting each joint in your body. This movement lubricates the synovial fluid, the body's natural joint oil, and stimulates small mechanoreceptors that improve proprioception, or the brain's awareness of body position. Most people over 60 begin to lose proprioceptive sensitivity, which leads to poor balance and falls. But this simple movement helps counteract that decline. Medical studies from Tokyo University have shown that daily joint rotations reduce stiffness and arthritic discomfort by up to 30% over 3 months, even in participants aged 70 and above. The second movement is known among Japanese elders as the torso twist of longevity. Standing with feet shoulder width apart, they slowly rotate the torso side to side, allowing the arms to swing naturally like pendulums. The beauty of this exercise lies in its effect on the spine and the internal organs. By gently twisting, you activate the spinal column, promote spinal fluid flow, and massage the abdominal cavity, which aids digestion and detoxification. As a surgeon, I can tell you that many of my elderly patients suffer from sluggish gut motility, partly due to inactivity and medication side effects. This simple movement helps to counter that by stimulating the vagus nerve, a key player in the gut-brain axis. Furthermore, it enhances blood flow to the liver and pancreas, organs that play a central role in metabolism and blood sugar regulation. In Japanese culture, this practice is also symbolic. The twisting motion represents wringing out negative energy and preparing the body to receive the freshness of a new day. The third exercise, called the sky reach and earth bend, mimics the natural flow of the elements. Standing straight, the individual inhales deeply while raising both arms toward the sky, stretching the chest and lengthening the spine. Then, with a slow exhale, they bend forward, letting the arms dangle toward the ground, allowing gravity to decompress the vertebrae. This alternating movement of expansion and release is a powerful stimulus for the lungs, diaphragm, and lymphatic system. It oxygenates the blood and helps drain lymphatic fluid, which carries immune cells throughout the body. From a medical standpoint, this movement improves respiratory function and maintains spinal elasticity, 2 major factors in healthy aging. Many Japanese elders perform this movement near open windows or gardens, inhaling fresh morning air to combine physical therapy with environmental exposure, what we might call aerobic mindfulness. The fourth morning movement is something I often recommend to my older patients recovering from cardiovascular surgery. It is the gentle knee lift march. Without moving from one spot, the person lifts one knee at a time toward the waist while maintaining balance and upright posture. This may look simple, but it has profound cardiovascular benefits. It engages the core muscles, stimulates venous return blood flow back to the heart, and strengthens the hip flexors' crucial muscles for walking stability. For people over 60, maintaining strong hip flexors is essential to prevent the shuffling gait associated with aging. A Japanese study in Okinawa, where some of the world's longest living people reside, revealed that those who practiced daily knee lifts for just 5 minutes had a 25% lower incidence of lower limb weakness compared to those who did not. Beyond physiology, the rhythm of the movement, coordinated with deep breathing, stabilizes the autonomic nervous system, balancing the heart rate and reducing morning blood pressure spikes. Finally, the fifth movement is known as the palm press and energy center breathing. This involves placing the palms together in front of the chest, closing the eyes, and taking slow, measured breaths, inhaling through the nose for 4 counts, holding for 2, and exhaling gently through the mouth. As the palms press together, subtle muscle contractions occur in the chest, shoulders, and arms, stimulating circulation while promoting mindfulness. From a neurological point of view, this practice activates the parasympathetic nervous system, the body's relaxation mode, which is vital for reducing cortisol levels and maintaining hormonal balance. I have observed patients who began each morning with mindful breathing exercises show measurable improvements in blood pressure, mood, and even glucose regulation. The Japanese see this not just as an exercise, but as a moment of gratitude to the body, an acknowledgement that the vessel carrying them through life deserves daily care and respect. Each of these 5 movements takes less than 15 minutes combined, yet their impact is exponential when practiced consistently. The simplicity is their genius. Modern fitness culture often tells us that we need complex routines, machines, or supplements. But longevity science shows that it is the daily, low-intensity, mindful movement that sustains the body over decades. These movements are performed slowly, intentionally, and always with deep breathing synchronizing motion with life force. In hospitals and rehabilitation centers, I often teach variations of these same movements to patients recovering from surgeries because they enhance circulation, prevent blood clots, and accelerate healing without strain. When I see Japanese elders perform them, I see medicine in motion, a living form of therapy that doesn't require a prescription, only consistency. Now, let us understand why these 5 morning movements are not only culturally meaningful, but physiologically superior for those over 60. The aging body undergoes several predictable changes. Muscle fibers shrink, bone density decreases, ligaments stiffen, and cellular repair slows. However, these changes are not fixed sentences. They are modifiable through targeted activity. Each of the 5 Japanese morning practices works directly against one or more of these age-related processes. When viewed through a medical lens, their effectiveness becomes even more remarkable. Take the joint awakening stretch, for example. As we age, the production of synovial fluid, the lubricant that allows joints to glide smoothly, declines. This causes stiffness, particularly after sleep, when the joints have been immobile for hours. By rotating the joints upon waking, you are essentially signaling the body to refill the oil. Blood flow increases to the surrounding tissues, warming up tendons and ligaments. Moreover, studies using ultrasound imaging have shown that regular gentle movement helps maintain cartilage thickness, a critical factor in preventing osteoarthritis progression. For a 65-year-old, this means greater ease in daily activities, from tying shoes to climbing stairs. The Japanese emphasis on daily consistency rather than intensity is precisely why they maintain mobility so well into old age. Next, the torso twist of longevity offers a fascinating insight into the body's internal mechanics. Twisting mobilizes the spine's thoracic and lumbar segments, regions that commonly stiffen with age. This not only reduces back pain, but enhances flexibility and balance. As a surgeon, I often stress the importance of spinal health because every nerve in the body branches from the spinal cord. When the spine is flexible, nerve impulses flow more efficiently, optimizing organ function. Additionally, twisting movements compress and decompress the internal organs, which improves lymphatic drainage and detoxification. The Japanese have long associated this with maintaining internal purity and emotional balance. Modern medicine now recognizes that regular torsional movement enhances digestive efficiency and liver enzyme activity, key markers of metabolic health. Then there is the sky reach and earth bend, a rhythmic motion that aligns posture, respiration, and mental clarity. By stretching upward, the intercostal muscles between the ribs expand, allowing the lungs to fill more completely. This boosts oxygen intake, which is vital for cellular repair. When bending forward, the spine lengthens, relieving pressure on intervertebral discs. The downward position also facilitates cerebral drainage, helping reduce morning dizziness, a common complaint among older adults. Many of my elderly patients who integrate this movement report fewer headaches and improved alertness. The act of breathing deeply through this motion also enhances parasympathetic activity, promoting calmness and reducing the heart's workload. In essence, this exercise combines respiratory therapy, spinal care, and mental focus in one fluid act. The gentle knee lift march serves as a built-in cardiovascular conditioner. For individuals over 60, maintaining leg strength is equivalent to maintaining independence. The legs contain some of the largest muscles in the body, the quadriceps, hamstrings, and glutes. These are also the main drivers of blood circulation when walking. Weak leg muscles lead to poor venous return, swelling in the ankles, and even clot formation. By performing controlled knee lifts, Japanese elders sustain circulation, improve muscle tone, and enhance balance. Moreover, the rhythmic lifting improves muscular coordination, retraining the brain's motor cortex crucial for preventing falls. In medical rehabilitation, we use similar low-impact movements to retrain stroke patients or those recovering from joint replacements. The science behind it is clear. Consistent, low-load movement preserves mitochondrial density in muscle cells, effectively slowing biological aging. The fifth movement, palm press and energy center breathing, bridges physical health with emotional well-being. As a surgeon, I am acutely aware that stress is a silent accelerator of aging. Chronic cortisol elevation contributes to inflammation, hypertension, and even cognitive decline. This breathing practice, performed with mindful attention, directly lowers cortisol and increases endorphin release. The simple act of pressing the palms engages isometric muscles, improving grip strength, a known predictor of longevity. In one fascinating study from Kyoto, elders who practiced deep breathing with muscle engagement showed improved heart rate variability, an indicator of cardiac resilience. Furthermore, the meditative nature of this exercise promotes neuroplasticity in the prefrontal cortex, improving focus and emotional regulation. It is a perfect example of how traditional wisdom aligns with neuroscience. What makes the Japanese approach so sustainable is not the intensity of the exercise, but the integration of body and mind. Every movement is performed slowly with deep breathing and awareness. In contrast, Western exercise culture often emphasizes high intensity and quick results, which can lead to injury or burnout, especially in older adults. The Japanese philosophy treats movement as medicine, not as punishment for the body. It is no surprise that Japan has one of the lowest rates of elderly disability and one of the highest life expectancies in the world. I often advise my patients to create a quiet morning ritual, perhaps after brushing their teeth and drinking a glass of water, and dedicate 10 to 15 minutes to these movements. The consistency builds discipline and rhythm in the body's internal clock, also known as the circadian rhythm. Regular movement at the same time each day synchronizes hormonal release, particularly cortisol and melatonin, in optimizing energy during the day and sleep at night. Over time, this gentle discipline becomes more than an exercise routine. It becomes a dialogue with one's body, a daily affirmation that age does not define vitality. The deeper lesson we can take from the Japanese elders is the respect for small habits. They do not rush. They do not count repetitions or chase numbers. They simply move consistently, peacefully, and purposefully. The results are profound: improved posture, better digestion, enhanced mood, and a stronger sense of connection between mind and body. As a physician, I find this approach more sustainable than any supplement or complex gym regimen. It aligns with the principles of functional medicine, treating the person as a whole system, not a collection of parts. So when you ask, "Doctor, what should I do every morning to stay young and strong at 60, 70, or even 80? I answer, start small, move gently, breathe deeply, and respect your body's wisdom. These 5 movements are not merely exercises, they are acts of gratitude, preventive medicine, and self-care. The Japanese elders are not just living long, they are living well. Now that we have examined the philosophy and physiology behind these 5 morning movements, let us go a step deeper into understanding why they are so uniquely powerful for individuals over 60 from a clinical and scientific perspective. In my years of medical practice, I have observed that the difference between those who age gracefully and those who struggle is not just genetics. It is daily behavior. Every small choice we make affects gene expression, hormonal regulation, and cellular integrity. The Japanese morning movement ritual exemplifies what we now call epigenetic wellness, the ability to influence your biological destiny through lifestyle. When performed regularly, these 5 movements stimulate a cascade of biological responses that enhance cardiovascular efficiency, improve metabolic rate, support musculoskeletal resilience, and even slow neurodegenerative decline. Let's begin by revisiting movement 1, the joint awakening stretch. From a biomechanical standpoint, this routine increases the production of synovial fluid by activating the synovial membrane that lines the joints. This natural lubrication prevents friction and wear. Additionally, the movements stimulate the mechanoreceptors and proprioceptors located in tendons and ligaments, sharpening the brain's mapping of the body. Why is this critical after 60? Because proprioceptive loss is one of the earliest precursors to falls, which remain a leading cause of injury and death in the elderly. By retraining the body's sense of balance each morning, we are essentially reprogramming neural circuits that maintain coordination. In Japan, elders are taught to move slowly with awareness. This conscious attention also strengthens cortical activity related to motor control, which helps preserve brain health. It's a movement that not only keeps the joints mobile, but also keeps the brain alert. The torso twist of longevity, our second movement, provides more than spinal flexibility. When the torso rotates gently, there is alternating compression and decompression of the abdominal cavity. This massage-like action stimulates peristalsis, the wave-like motion of the intestines that helps move food along the digestive tract. Many older adults experience constipation due to slower bowel movement and medication side effects. Instead of relying on laxatives, this simple twisting motion can promote natural digestion. Additionally, gentle spinal rotation improves blood flow to the intervertebral discs, keeping them hydrated. Dehydrated discs are a major cause of lower back pain, one of the most common complaints in older adults. There's also a remarkable effect on the lymphatic system. Twisting the torso acts as a pump that assists lymph flow, helping remove metabolic waste and supporting immune defense. This connection between movement and immunity is something modern medicine has only recently begun to appreciate. Japanese elders, through centuries of tradition, have practiced it intuitively. The sky reach and earth bend, or the third movement, deserves particular medical appreciation because it activates what we call the kinetic chain, the harmonious engagement of multiple muscle groups. When the arms lift skyward, the diaphragm expands downward, allowing maximal lung inflation. This not only increases oxygen intake, but also stimulates the vagus nerve, calming the heartbeat and stabilizing blood pressure. When the body bends forward, gravity assists venous return, blood flow back to the heart, and enhances cerebrospinal fluid circulation, which supports brain detoxification. A growing body of research on the glymphatic system shows that gentle inversions help clear amyloid plaques, which are associated with cognitive decline and Alzheimer's disease. So, when an elderly Japanese man performs this daily ritual, bending slowly toward the earth, he may be unknowingly protecting his brain from future degeneration. Furthermore, the stretch and release of the hamstrings, spine, and shoulders maintain flexibility and posture, two essential determinants of vitality in older age. The gentle knee lift march, movement 4, integrates cardiovascular activation and balance training in a single, low-impact form. Each controlled lift of the knee engages the hip flexors, quadriceps, and abdominal muscles, which are often underused in sedentary lifestyles. What makes this movement exceptional is its rhythm. Done slowly, with deliberate breathing, it becomes an exercise in coordination and stability. Studies from the Japan Geriatrics Society have documented that seniors who perform rhythmic leg lifts for 10 minutes each morning exhibit improved gait speed, lower resting heart rates, and higher VO max, a measure of oxygen efficiency. These are measurable indicators of cardiovascular health. Additionally, the movement increases baroreceptor sensitivity, the mechanism by which the body regulates blood pressure when changing positions, such as standing from a chair. Poor baroreceptor response is a common cause of dizziness and falls in older adults. Thus, a few minutes of daily knee lifting acts as both a preventive exercise and a balance therapy session. Finally, the palm press and energy center breathing, the fifth movement, represents the heart of Japanese longevity practices, the integration of breath, body, and awareness. In Western medicine, we often underestimate the therapeutic potential of breathing. Yet, controlled breathing directly influences the autonomic nervous system, the regulator of heart rate, digestion, and hormonal secretion. When we inhale deeply through the nose, we activate the parasympathetic system, lowering blood pressure and promoting relaxation. When we exhale slowly, carbon dioxide levels rise slightly, which causes blood vessels to dilate and enhances oxygen delivery to tissues. In elders, this improves oxygenation to the brain and muscles, reducing fatigue. Combined with gentle palm pressure, the exercise provides mild isometric resistance, improving upper body strength and posture. From a psychological standpoint, this breathing routine enhances mindfulness, a mental state proven to reduce anxiety, improve focus, and even lengthen telomeres, the protective caps of DNA linked to aging. So while it may appear as a moment of stillness, it is biologically dynamic. Another key reason Japanese elders remain active and independent well into their 80s and 90s lies in their holistic understanding of health. Movement is not treated as a chore, but as an act of gratitude and self-respect. This mindset influences hormonal and neurological outcomes. When you approach exercise with joy instead of obligation, your body releases endorphins and oxytocin rather than stress hormones. These positive biochemicals enhance immune function, accelerate healing, and improve mood. As a surgeon, I've seen this firsthand. Patients who maintain optimism and daily movement recover faster from surgery and show fewer complications. It's not magic, it's physiology. Let's also discuss how these practices influence metabolic and hormonal balance. With age, insulin sensitivity decreases, and many older adults develop prediabetes or type 2 diabetes. Regular morning movement increases glucose uptake by muscle cells independent of insulin, effectively lowering blood sugar levels naturally. Moreover, light exercise on an empty stomach before breakfast, as practiced in Japan, enhances fat metabolism. It gently signals the body to use stored fat for energy, aiding in weight management. Simultaneously, movement triggers the release of myokines, anti-inflammatory molecules produced by muscles during activity. Myokines help protect against chronic diseases such as cardiovascular disease, dementia, and even certain cancers. Thus, these 5 movements operate on multiple systems at once: muscular, cardiovascular, endocrine, and neurological. An equally important aspect is neuroplasticity, the brain's ability to adapt and form new connections. Research has shown that consistent low-impact exercise, like these Japanese morning routines, increases blood flow to the hippocampus, the brain's memory center, and stimulates the production of brain-derived neurotrophic factor BDNF, often called fertilizer for the brain. BDNF supports the growth of new neurons and strengthens existing neural networks. This is why elders who remain physically active tend to retain sharper memory and faster cognitive function. In my medical opinion, when a 70-year-old performs these mindful movements each morning, they are literally rewiring their brain toward longevity. Let us not overlook the cardiovascular implications. Aging arteries tend to stiffen, contributing to hypertension and reduced cardiac output. The controlled breathing and rhythmic movement of these exercises improve endothelial function, the ability of blood vessels to dilate and contract. This keeps arteries supple and responsive. The result is lower blood pressure, better oxygen delivery, and a reduced risk of heart disease. Additionally, regular movement enhances venous return from the legs to the heart, reducing edema, swelling, and preventing varicose veins. In surgical recovery, we emphasize similar principles. Movement is medicine. Even the simplest circulation exercises after surgery reduce complications dramatically. Culturally, Japanese elders perform these exercises in group, often in parks or community centers, accompanied by soft music or nature sounds. This social aspect provides another layer of benefit, community-driven wellness. Social engagement reduces loneliness, boosts immune function, and lowers the risk of depression. From a neurochemical view, shared physical activity increases serotonin and dopamine, enhancing both physical and emotional well-being. The practice becomes not only about movement but about connection, a vital medicine for the human spirit. In modern medical terms, the 5 morning movements can be seen as a comprehensive low-intensity, full-body therapy that promotes balance between the sympathetic active and parasympathetic restorative systems. It is gentle enough for those with joint issues, yet potent enough to improve metabolic health. It is accessible, requires no equipment, and costs nothing, making it a perfect prescription for global aging populations. I have often recommended similar routines to my patients, and many report improvements in mobility, sleep, digestion, and even mental clarity within weeks. To summarize the scientific essence, the joint awakening stretch combats stiffness, improves balance, and preserves cartilage. The torso twist aids digestion, enhances liver function, and boosts spinal mobility. The sky reach and earth bend improves posture, lung capacity, and brain oxygenation. The knee lift march strengthens the legs, supports cardiovascular health, and prevents falls. The palm press and breathing regulates stress hormones, enhances focus, and stabilizes mood. Each movement, when performed daily, acts as a signal to the body. Stay young, stay flexible, stay alive. The Japanese elders are not defying age. They are cooperating with biology. They respect the body's natural design and nurture it through motion. If every person over 60 embraced even a fraction of this discipline, we would see a revolution in elder health outcomes worldwide. So, as a physician and surgeon, my advice to anyone listening is simple. You don't need a gym membership or expensive supplements to reclaim your vitality. You need 10 minutes each morning, a little curiosity, and a commitment to move. Let the wisdom of Japanese elders guide you. Begin with gratitude, move with intention, breathe with purpose, and watch how your body, mind, and spirit respond. Age may be inevitable, but decline is not.